My only diagnosis would be there is an abnormality with the P wave and a T wave. That shows what? I'm not sure.
So you are not sure what the final diagnosis
Yes.
is? You can see an abnormality in the P wave and the T wave.
Yes. Maybe I can figure it out since he can't give me one.
Okay, girls, so anything to add to what Saad said? So what could be the diagnosis of this case? So you have 60 years old male, just with a history of coronary artery disease, presented to the emergency department with symptoms of palpitations, and when you did the examination, you can find that the pulse is irregular and the rate is 150 beats per minute, blood pressure 90/60, and there is hyperventilation.
I'm thinking there is maybe premature atrial contractions here. Yeah. Maybe that is why there is the P wave is not normal. And maybe since he has a history of coronary artery disease, maybe there is ischemia to the atrial walls. Maybe that is one reason. And the T wave. And the T wave is not normal. It's inverted because maybe it's also prematurely, like the ventricular repolarization is also premature. So maybe that's the reason.
Now I'm just getting description, not the diagnosis. حد عنده تشخيص للمرض؟ حد عنده تشخيص للحالة؟ ده مشروع دكاترة؟
Is it possible that he has an atrial fibrillation?
Based on what?
Based on the absence of the P wave and a T wave. صح?
So based only on your ECG?
Yes, based on the ECG reading.
Okay. So anyone here agrees with Saleh? Atrial fibrillation or something else? لؤي؟ أنت معاك؟ وافقت في الرأي يعني.
أول مرة في حياتي.
طب كويس الحمد لله نعمل كل شيء في أول مرة. Okay. So what could be the diagnosis? Doctors? During your internship, I would like to see this case. It's common. ما شاء الله. كل مسافر أحب أسيبكم وزارة الخاص وحنا نقدم نتقابل الأسبوع الجاي ونكمل مثلا. يا ريت. اوكي. طب تعملوا الأسبوع اللي بعده عندكم امتحان فيسيولوجي والكلام ده داخل في الامتحان ولا طز؟ ما هو عشان كده عاملين امتحانات متتالية ورا بعض.
يا ريت.
So, do you expect me just to say that diagnosis? What the point of trying to read some ECGs or giving scenarios? So just I can. It's not my problem because I'm not sure when you're going to get internal medicine, but during the internal medicine I'm going to learn loads about cardiology. So what's my problem? Why did you ask me to do it? شوية حركة يا شباب والله خير منكم وأعمل المحاضرة وتصل في السيناريوهات. أوكي. ده براحتكم تماما. طالما كله عادي زي تلبية السلطان كده. It's up to you. I'm sorry إن أنا يعني ضيعت وقتكم بالنسبة للكيس سيناريوز. معلش انا محتاج حد هنا معايا عشان يساعدني او لو حد معاه الوايرلس ماوس عشان ننقل السلايدز.
Very good.
slides أو بس دي ترجمة. شكرا. Okay, so last time we talked about ECG or the cardiac cycle from electrical point of view. Today, inshallah, we're going to continue with the cardiac cycle, but from a mechanical point of view. So just to have to bear in mind that a cardiac cycle or single heartbeat consists of two things: diastole, relaxation of the cardiac muscle, and systole, contraction of the cardiac muscle. So now we're going to look at these actions from mechanical point of view and just let's see how it happens. So basically we have three phases in the cardiac cycle. The first step or the first phase is atrial systole. The atrium is going to contract. This is followed by ventricular systole, contraction of the ventricles, and the end phase is ventricular filling or just relaxation to get more blood from the atrium, and this cycle keeps going on and on and on every single beat. However, if we look at the ventricular systole and ventricular diastole, we're going to find that each one of them, each one of these phases, has three sub-phases or has three sub-categories. So just going through the names, so for systole and diastole, we have almost the same names repeated between the phases. So the first step, we have isometric contraction. Isometric contractions meaning that there is an increase in the pressure, however, without a change in the size of the ventricle. The length of the muscle is not changing, so just it's building up pressure without a real contraction. Okay. The next step is maximum ejection phase, where the ventricular muscle contracts with the maximum force and ejecting the blood with the maximum capacity. And the last stage is the reduced ejection phase, where just what was remained in the ventricle just is going to be pushed outside, but with a minimal force. When we look at the ventricular diastole, we're going to see the same steps again, however, just regarding relaxation. So the first step is isometric relaxation. So the tense inside the muscle is decreasing, however, the length is not changing, and this is why it's called isometric. Followed by maximum filling phase, where the ventricles are filled with blood at the maximum speed, and then reduced filling phase, which is minimum filling of the ventricles. So just I want to discuss each phase separately, and again, please just I would like to have some interaction with me. Okay, next please. Yes. Okay. So as I said last time, in each phase we are going to discuss few common points: the amount of blood pushed, the valve that opens or closes, and the electrical impulse that we are going to get in this phase, the ventricular and atrial pressures in that phase, and if we can hear any heart sound created during that phase. So if you look at the first phase, which is atrial systole phase, or systole of the atrium, contraction of the atrium. What happens is that during the contractions, the atrium only pushes 30% of the blood inside the ventricle. Okay? So when it contracts, it will push 70% of the total amount of blood that should enter the ventricle at that time. So what about the other 70%? Where do they come from? Passive. So if passive, in which phase do you think they will enter the ventricle?
Filling.
Maximum filling. موافقين؟ يتنبأ موافقين؟ مفيش أي خالص. هو ده عامل زي الفيلم العربي تعملوا كده يموتوا كده يموتوا. N systolic volume. So try to interpret this N systolic volume. So it's something related to systole. So when you describe end systolic volume, is it atrial or ventricular systole? So when the ventricles are contracting, do they receive blood? So can you feel something that is closed? It's contracting. So you need it to relax so you can feel it. And diastolic volume. Okay, so again, try to interpret this. So what does it mean end diastolic volume? End diastolic volume means that the total amount of blood existing inside the ventricle is just before the contraction. So it means just how many mils of blood are inside the ventricle before it starts contraction, just to start to count the stroke volume about the amount of blood ejected by the ventricles, and then we can find the end systolic volume. Okay. So what happens that when the ventricle is relaxing at the maximum ejection phase, just the blood passively from upward towards downwards. Just the valves are going to be open, and then when you have a sink, okay, just what happened that the water or the liquid just going to passively pass into the sink. So this is what you have. You have an open valve that will allow the blood to go passively. So 70% of the blood ejected by the atrium goes passively with no force, with no contraction. That just depend on the gravity. However, the remaining 30% need some force to be pushed inside the ventricles, and this is why we have atrial systole. So the duration, it is very short. It is 0.1 second, just even before you blink. The atrial pressure, it is higher than the ventricular pressure at that point because it is contracting and the ventricles are relaxed, so the blood can move, and you have the pressure is around 7 to 8 millimeter mercury. However, it will return back to zero once this phase stops. مجرد ما الانتباه او الكونتراكشن بتاعت الاتريا تخلص هيرجع البريشر بتاعه تاني زيرو علشان just to allow the ventricles to contract and not making an against force for the ventricle. The ventricular pressure, it will start, first it will start to increase because just there is blood pouring inside the ventricle, so just I will have a little bit of pressure inside, and then it decreases because the ventricles are just relaxing, so it will lose the inside pressure. Next, please. Okay. So the ventricular volume, okay, so at this stage we are going to get the end diastolic volume, meaning the maximum amount of blood existing in the ventricle just before the contraction. يبقى الاند diastolic volume التعريف بتاعها المبسط هي كمية الدم اللي متواجدة داخل الفنتريكل just before its contraction. So that we will have end diastolic volume just after that systole of the atrium. So for the aortic valve, what do you think? Open. هي مكتوبة قدامكم بس أنا عايز حد يفكر. هلا aortic what about the aortic valve? Is it open, closed? During the atrial systole, but still in the atrial systole. The atrium are just contracting.
It should be closed.
Closed. What's the reason that it's closed?
To prevent any passive blood falling from the aorta back to the ventricles.
Okay, but what is the mechanism behind closing the aortic valve?
Increase the pressure.
Yeah.
Inside the ventricle.
Exactly. Very low pressure inside the ventricle and high pressure in the aorta, so automatically the valves are going to be closed. Okay, so at that point, the ventricular pressure are very low and they are below the aortic pressure. So this is why the valves are going to be closed. You cannot open against a high pressure. Okay, so if it's the pressure on the doors, when you try to open them, you won't be able, except if you apply force against what is opposing you, so you can open them. Otherwise, it will stay closed. Okay. So for the AV valve, it is the opposite. So the atrioventricular valve are going to be open. Okay. First, because of that, for two mechanisms. And you tell me what are the two mechanisms that will keep the AV valves open. ماشي يا شباب. الحمد لله ده الحاجات اللي فيه معانا.
AB stands for what? Anterior valve?
أنا مش سامع أنت بتصوت؟
AB stands for anterior valve.
Atrioventricular valve. So the valves between the atria and the ventricles are open. Why? There are two main reasons that they are open.
Pushing of the blood from the atria to the ventricles. Pushing of the blood. There's no actual
Pushing. So what do you mean by pushing? When you say the verb pushing, so it means using force. So the pressure inside the atrium is higher than the ventricle. So they will push the valves, the doors open to allow the passage of blood. So this one mechanism. And the other one is just because of gravity. So once the ventricles are relaxed, so the pressure is low, so the gravity will allow the valves to go down, allowing the opening of the passage, so the blood can go from the atrium to the ventricle. Okay, is it clear? And if we combine, or just if we try to conjugate this mechanical step with the electrical analysis of the cardiac cycle, so we start to get the P wave indicating atrial depolarization or atrial contraction. Okay. And for the heart sounds, usually when you hear the cardiac or the heart sound, you have 4 spots. And I'm not going to talk any more clinical because you are not interested. Anyway, what we usually...
Some of us are, sir. Some of us are. Some people care.
Anyway, just I'm dealing with the whole M1, not just with few persons. So you asked me last time just to try to include the ECG. I did my best. I lost some time during my weekend just to prepare the scenarios for you. Okay, just something that you can understand and interpret common ECG problems. But you are not interested, so it's not my problem. That's it. So we can hear 4 sounds in the heart depending on the side that I'm going to put the stethoscope. Okay? The main 2 heart sounds are the first and second heart sounds, and we're going to learn how to hear them. However, just we have the 4th heart sound that it is created during the atrial systole, but if you don't listen to it in one person, that's fine. But when it starts to appear in a patient, especially like a murmur, then you have to expect some abnormalities with the mechanics of the heart. So when hearing heart sounds, just it is suggestive of a problem in the mechanics of the heart system or the cardiac system, meaning that there is a problem in opening and closing the doors or problems in pushing the blood inside certain vessels. Next. So now we are going to go to stage 1 into the second phase, isometric ventricular contraction, or isometric contraction of the ventricles. So what happens here? So if again we try to talk about the steps. So what about the atrial pressure? Is it higher or lower than the ventricular pressure? Lower, because it has done its own work. So now it's relaxing and allowing the ventricles to start their own contractions. So what about the pressure inside the ventricles? Are they increasing? Decreasing as they are? Increasing. However, there is no change in the volume of the ventricles. So this is why it's called isometric. There is no actual contraction. There is no change in the length of the muscle fibers. Okay? So just it is building a thrust to push the blood the next stage and allow maximum ejection of the blood from inside the chamber. For result, it's like I am getting my engine on and just pushing the pedal on the petrol and just hearing, but actually I'm not moving. Still, I have one more step to get the green light and start pushing the blood inside the outlet. So the duration is even lesser than the atrial contraction. It's about 0.05 seconds. And as I said, the ventricular pressure are going to start building up, increasing, and we will have the AV valve closed. So what about the aortic valve? Open or closed?
Still closed. Still closed.
Still closed.
Because it's still
Closed?
building. Maybe
Closed?
how come it will be open if the ventricles are still building pressure?
Exactly. So if you just give them space, the pressure is going to escape from inside the chamber. So you have to keep everything closed and tight inside the chamber. So you are creating a positive pressure that will overcome at some point the aortic pressure, which is 80 millimeter mercury, and allow the blood to move inside the aorta. Next, please. So we have no change in the ventricular volume. The aortic valve are closed. The aortic pressure is decreasing, just reaching up to the 80 millimeter, and at the same time, you are going to see that the ventricular pressure is increasing to reach up above the 80 millimeter to allow the pushing of the blood and reach its maximum about 120 in the next stage. AV valves are closed, and this is how we heard the first heart sound. The closing of the AV valve just will give us the first heart sound, the lub. So when you listen using your ears, you just hear lub, dub, lub, dub. Lub is the first heart sound, it's the close of the AV valve. For the atrial pressure, it's nearly zero, just going back to so it is increasing just because the ventricles are bulging inside the atrium, because it is can you go back to the first picture? So in the isometry, so now the ventricles are increasing the pressure. However, at the end, just because of increasing pressure, this septa separating the upper and lower chambers, شايفين يا شباب؟ just it's going to bulge inside the atrium. من كتر الضغط اللي هيحصل ان الغشاء او الفاصل اللي موجود ما بين الابر اند لور هيحصل له نتوء الى داخل الاتريوم. فاحنا فاكرين ان الاتريوم بيحصل له باسيف كونتراكشن، فده هيزود البيت البريشر inside the atrium. Yes. Okay. For the ECG, we are going to get the Q wave. So again, if I try to conjugate the electrical and the mechanical cardiac cycle, so isometric contraction is indicated on the ECG by the start of the Q wave, just the little bit depression that you can see in the QRS properties. Next, please. Okay. So now going to the maximum ejection phase, the thrust, the maximum push of blood inside the aorta. So at that point, the pressure inside the ventricles will reach 120 mercury. So they are well above the aortic pressure. So what will happen to the aortic valves? It will definitely open, allowing the push blood from inside the ventricle towards the aorta or the systemic circulation. So what will happen to the volume of the ventricle? Decrease. So it is contracting, so definitely its volume will decrease in size. But in here, we are going to have a term called the stroke volume. And I believe you talked with Dr. Refat about the cardiac output, okay? So the stroke volume is the amount of blood pushed by the ventricle in each cycle, okay? Multiplied by the number of the heart rate will give us the amount of the total cardiac output. How many liters of blood have been pushed by the ventricle during the minute, which is the cardiac output. So at that point, you have the aortic valve opens. The aortic pressure is increasing from 80 to 120 due to the pump of blood. So I'm pushing the blood with a high velocity inside the aorta. So again, it will start to build up some kind of pressure. So it will start rising from the 80. So it's like I'm transferring the blood plus pressure from the ventricle towards the aortic artery. So the ventricular volume will start to decrease because it is contracting. الحجم بتاعه الطبيعي لازم هيصغر. Next. And okay. So the atrial pressure we will have an initial decrease because just it is pushing the ventricle are pushing the blood. حتى البالجنج اللي حصل بسبب البيلدينج بريشر inside the ventricle خلاص هيختفي، فهيحصل initial decrease بالنسبه للاتريوم، هيبقى هو كمان تقريبا قرب الزيرو في البريشر بتاعته. علشان just to so what I was saying, so I talked in Arabic. So what I was saying that in this phase the atrial pressure are going to drop back to zero. That's simply because that the bulging that happened during the isometric contraction of the ventricles, it's just going to drop back because the ventricles are just losing blood. So the space inside the atrium are getting bigger, allowing the pressure to drop down. And at the same time, during this phase, the atrium will start to receive blood coming back from either the systemic or the pulmonary circulation to allow ejection later on inside the ventricle. So the AV valve closed in that stage also, and and this is the continuation of the first half sound just by listening to the pushing of blood inside the aorta, and it is ECG. I'm sure we are in the proper. Okay. So now we had done during the contraction, the QRS complex has been done between the two phases because electricity must precede the mechanical action itself. So once we got the maximum ejection phase, the QRS has been completed, and we will start to have the origin of the T wave. Origin of T waves indicates that the maximum ejection phase has been done. Next. So the final stage is the reduced ejection. Now the ventricles are at maximum contractions. They are just pushing what was left inside into the aorta. So this is also again 0.1 second in duration. The ventricular pressure are decreasing rapidly, and the ventricular volume decreasing also. The aortic valves are still open. Aortic pressure decreasing because just the blood is leaving from the aorta toward the systemic circulation. So just it's moving again, taking the pressure with it just to allow the blood to open any vessel on its way. Okay. So when it's just look at it like this. So when the ventricle contract, they are giving blood plus pressure, and both must move together. Okay, the blood won't move without pressure, and this later on we are going to study the blood pressure and the importance of having blood pressure inside our vessels, just to allow the opening of the arteries and movement of the blood inside the body. Understand something?
No, I'm just imagining something.
Okay. So the atrial pressure, it is still increasing, just to allow to, because it is getting blood from the vena cava, our pulmonary circuit, and the AV valve is still closed, and there's ECG. At this stage, you have the top of the T wave, the maximum of the T wave. So now just as a quick revision, so we have the contraction of the ventricles divided into 3 stages. The first stage, the ventricle is trying to build up pressure. Everything around the ventricle is closed, the pressure is increasing, and everything else just is decreasing the pressure. The isometric or the start of the isometric contraction is indicated by the Q wave on the ECG, and it takes a very short time length, about 0.05 to be completed. The next step is the maximum ejection phase, where the ventricles actually contracts, where the length of the muscle just is decreasing to push the blood outside. So again, when it's pushing the blood, the pressure inside the aorta start to increase again from 80 to 120 during this stage, because it's taking the blood plus the pressure from the ventricles. The AV valves are closed, and we have the aortic valves open to allow the passage of the blood. And on the ECG, it is indicated by the start of the T wave. The end stage is the minimal ejection phase, where just the ventricle is trying to push what was left inside, and it is indicated by the top of the T wave of the ECG. Still, the aortic valve open to allow the movement of the blood. However, the pressure inside the aortic valve starts to decrease bit by bit because the blood is moving and taking the pressure with it alongside, just to open the remaining of the blood vessels on its pathway to the systemic cells. So when we next slide, please. So now we are going to do the same thing. So as we took 3 steps or 3 stages just to contract, so the ventricles will need 3 more steps to completely relax and allow the movement of blood from the atrium inside the ventricle once more. So it will start with the same order. We will have isometric relaxation, meaning that the tens inside the muscle fibers are decreasing. However, the size of the volume of the ventricle is not changing. It's still at its maximum volume at contraction, but the tens inside the muscles are just getting decreased. So this will happen at the end of the systole. So now the pressure inside the aorta of the pulmonary artery are higher than the ventricles. So what will happen to the aortic valve or pulmonary valve? It will start to shut down, close. Okay? And in this stage, you are going to start hearing the second heart sound. So valve closing indicates heart sound.
So the first heart sound was the open.
The first heart sound is the closing of the AV valve.
The second?
Closing of the aortic valve and pulmonary valve. Okay? So the doors are very smooth, so you cannot hear them open, but you can hear them
open.
No, shut. When you shut the door, you can hear
for the aorta.
the sound. سواء AV أو aortic. أو anyway, the AV ventricular and the pulmonary or aortic closure. Okay? However, we always refer to the left side because it is the strongest side in pushing the blood. But the same action is also occurring in the right side. So you have a pulmonary valve and you have an aortic valve. So are decreasing and the aortic valve suddenly closed, and this is what will give us the second heart sound. Next, yes. Okay. So the ventricular volume is not changing. The atrial pressure gradually increases because it's still filling blood from the vena cava. The AV valve is still closed, and the heart sound will get the second heart sound because this closure of the aortic and pulmonary valves, and on the ECG, the termination of the T wave is indicated. So now we are going to go to the second stage, which is maximum relaxation or maximum filling. Okay, good. Did you hear the sound?
Of what?
سمعت صوت or little bit? Next, please. Okay. So the maximum filling phase. So in this stage, the blood flow at high rate from the atrium to the relaxing ventricle. However, this is not due to the contraction of the atrium. It's passive movement of the blood from the upper chamber to the lower chamber. هو لوحده يعني؟ هو لوحده بيستمع للايباد ومستمع ل3 لزاز جدا يعني. If you are not interested, there are two doors. If you are not allowed to go to this one, so you can go for that. سامعني ايه؟ سامعني حاطط ايه يعني الهيدفونز في ودانك يعني سامعني ازاي؟ بيزد اون وات يعني؟ بيزد ان انت واقف ان انت محترم المحاضره اللي انت فيها؟ ولا يعني اديني حاجه اتعامل معاك بيها، اديني كونسبت اقدر اتفاهم فيه معاك ان انت قاعدين انتوا 3 وهتبقى واتشنج موفي تسمعوا ايا كان اللي تسمعوه، ان شاء الله اذا القران كريم. لو القران الكريم هو كلام المفروض انا اسكت لما يتقال، حضرتك عندك في اماكن اخرى مش هتقعد محاضرات تسمعها. ان انت كده بتحرجني انا وزمايلك انت المفروض تستمع معاك وانت بتسمعه. صح؟ ده اذا كان قران، فاي شيء اخر بدات تدير احترام للراجل اللي واقف في الجامع. صح ولا غلط؟
صح.
فأرجوكم لو سمحتوا عايزين أعمل نفسي بلايند، اتفضل. لو اجبرت حد وسبت حد منهم تقول اتفضل احضر هنا، او لو ما قدرتش هعمل فيك كذا، ولكن جيت بارادتك يبقى تحترم ان انت ايه ليك. تقدروا تقولوا لي اي حاجه من اللي انا قلتها؟ تقدر تعمل ديسكريبشن اي فيز من الفيزز اللي انا اتكلمت فيها؟ لا ليه؟ واي نوت؟ واي نوت عشان يوم في يوم في الايام لما يجي لك عيان تحت ايدك ويموت تقول اصل ما علمونيش صح؟ يعني انت مش هتتعامل مع سوري في اللفظ حمار، مش هتتعامل مع اسد، مش هتتعامل مع ايا كان الكائن الحي، مع انهم لهم حاطين في الحياه وجيت ولما قررت عليهم بذمه وادميه، لكن لما تيجي تتعامل مع انسان بهذا الاستهتار يبقى حرام عليك. ما ترضاهاش لاي حد من اسرتك، ما ترضاهاش لنفسك. ما تقدرش ان تبقى عندك بين وتروح للدكتور تلاقيه سوري في اللفظ مش فاهم حاجه. So, as I said, in this maximum filling phase, we are just having the blood pooling inside the ventricles just because of the gravity. There is no pressure from the atrium to push the blood inside the ventricle. Just it happens passively with no contraction force at all. So, at that point, we will have the atrial pressure more or increased over the ventricular pressure. The ventricular pressure is around 0 because it's totally relaxed, and the AV valve are open, which will allow the pooling of the blood. The ventricular volume is increasing due to the filling, and the aortic valve are closed. Just to tell you, it's very rare to see U wave on an ECG. However, this is something called U wave, but usually 99% you won't be able to see it, or it's not detected by an ECG. The aortic pressure are just decreasing because, as I said, the blood is moving away, and the heart sound, you get a third heart sound due to the rapid blood flow. So you just are hearing the sound of liquid going inside the chamber. Okay. However, usually they are not very easily detected. You need to train yourself because just the speed of the heartbeat just usually hear the AV close, the aortic close. Or you need to train yourself and just to place your stethoscope properly on the surface anatomy that you are going to have an exam later on, just to be able to hear the movement of the liquid. That's like I'm listening to the tap water. Just I can hear sound. However, because there are other sounds around it and major sounds shutting the two valves, so they are very faint. So you need to train yourself to listen to them. Okay. So we move on to the next phase, which is or the final phase, which is the reduced filling phase. Okay, at that point, the atria will start to contract, to spread themselves to contract, so they will start pushing the remaining 30% of blood again back into the ventricles and make it ready to contract. So the atrial pressure is around 0. However, it's around 3 or 4 millimeter mercury. Again, the ventricular pressure around 0. However, it's lower than the atrium. The AV valve still open. The ventricular volume increasing due to filling. Aortic valve closed. Aortic pressure decreasing, and it's going to be around the 80 once more. Next decimal, isn't it? Okay. During the cardiac cycle. Okay. So these are basically. Go to the next one and get back to this one, please. Go to the next slide. So basically, what I described now, maybe in about 45 minutes, just only takes 0.8 seconds to occur inside your body. And it took me 45 minutes to explain 0.8 seconds. So can you try to measure the speed? And I don't know how to say, but just التتابع اللي موجود, just the follow-up in each step just to occur or to happen. So this is what you can just see. So this is the third point. So this is the late diastole where just the blood is pulling inside the atrium and just passively going inside the ventricles. And then we get the atrial systole, the contraction of the atrium, to push the remaining 30% inside the ventricles. And then we will have an volemic or isometric contractions, where the ventricles are just preparing or increasing the pressure inside them to allow the pushing, and then we get the ejection phase, which are maximum and minimum ejection phase, and then we will start to get the relaxation phase, which also again divided into 3 stages, and this is the final one, the minimum healing phase, and you go through this cycle over and over again in less than a second. So just give it. So let's talk about the right and left side. The same mechanism in both sides, but are there any differences between the two sides?
Regarding mechanical differences?
The mechanical steps is the same. However, there's little bit of differences. What would be the first difference? Pressure?
One side have oxygenated blood and the other side have deoxygenated blood.
So difference in the content, oxygenated and non-oxygenated. What else? So we talked about pressure, we talked about the content. What else? I didn't hear what is. Which start before what?
Pressure of the ventricles, not the atriums. The atriums should be the same. Ventricles are different because the different sizes and chambers between the left and the right ventricles.
Oh.
The left ventricle is a smaller chamber than the right ventricle, so it should have more pressure in order to push the blood up in the aorta. But so the pressure in the atriums should be the same.
Pressure because the left side is pushing
in the ventricles, not
in the ventricles, not in the atrium.
Yes.
Okay. ماشي لو حد عنده شيء أكبر ليه؟ The direction of the blood. Okay. What else? احنا اتكلمنا على الكونتنت. We talked about the pressure. We talked about the direction and ايه تاني؟ The duration of the contraction. Contraction and relaxation. Valve. Translate or just give water. So the type of valves, but again we just would call them semi-lunar valves or atrial valves. So it's not a big difference. ايه تاني؟ حد عنده اقتراح؟
The heart sounds.
The heart sounds.
As in the AV will make the first heart sound, and then the aortic valve will make the second heart sound.
No, but the AV is just the set separating the upper and the lower, and the aortic and pulmonary valve will give us the second heart sound. So you can hear the second heart sound on the pulmonary side, or you can hear it on the aortic side, depending on which side you want to hear the second heart sound on, just to diagnose any problem for the specific valve. Okay. So for the atrium, which one is going to open the AV valve first, or contract first?
Right.
The left or the right atrium?
Right.
Right atrium will start pumping first.
Has to be right. Right, has to be right.
Right. Why?
Because there's a venous return. Receive the blood first.
So the blood is not oxygenated, so it needs to be pumped first. So this one explanation.
The same thing, it receives the blood first from the vena cavas, superior and inferior.
Mm-hmm.
This will receive the blood first, the deoxygenated blood. So it must be pumped up the lungs in order to oxygenate it, and it comes back to the left atrium.
Okay.
So she's right.
So they must pump at the same time. So we have here a different point of view. So they must pump at the same time. موافقين على الكلام ده ولا مش موافقين؟ شباب الايباد موافقين ولا معترضين ولا مش فارقه؟
على كلامه or on first.
انا بسألهم عن اي حاجه اللي اتقالت whatever what has been said either from the good side. Eh?
I disagree with him.
You disagree with him? I was just asking this strand. يعني صالح والاثنين التانيين ما يعني ايه دي؟ موافقين اجوزه له يعني عامل فيه ايه يعني مش فاهم. طيب. So what actually happened is that the right right side will start pumping before the left side in the atrium. But why? This is the main thing. Because the amount of pressure inside each ventricle is different. So for the right side, it is facing a lesser pressure than the left side. Because the atrium will create the same pressure. So it's much easier to open a lower pressure than opening the any valve between the left or the mitral valve, which lies between the left and between left atrium and left ventricle. Okay. However, during the contraction of the ventricles, we have the opposite. The first side to pump or to contract is the left side. Why? Pressure? So if it is about the pressure, which is higher? The right side pressure or the left side pressure? The pulmonary circulatory pressure or the systemic pressure? Left is higher. So how come against higher pressure, the left side is contracting first? Okay, it's something related to the anatomy, the exam that we're going to have. Anyway. So related to the anatomy of the heart.
It's related to the pumping blood to the body.
Related meaning, يعني solid conclusion, reach conclusion. Okay, it's related to this. Meaning what? ليه؟ ايه السبب؟ ايه الميكانيزم؟ ايه الفكره؟ ايه الكرايتيريا اللي يملكها left side more than the right side that will allow the left side to push or to contract before the right side? The hypertrophy of the muscle. The left side has more muscles inside it, so it can contract with more force, so it can initiate, and so the engine power from the left side is more. So it's like, for example, I'm talking about a Toyota Corolla against a Porsche. So which one do you expect to have the first hit to 100 kilometers?
Porsche.
Porsche or Toyota Corolla?
Porsche.
So the left side has more power, more horsepower, more muscle power. There is hypertrophy inside, as you can see, the length of the muscle compared to the right ventricle. في فرق كبير جدا، فعشان كده بيقدر هو يكونتراكت بقوة أعلى فيوصل to reach the threshold to push or to open the aortic valve is much easier for the although the aortic valve is higher than the pulmonary, the aortic pressure is higher than the pulmonary pressure. However, because of the mass of muscles inside the left ventricles, it will be able to open and push the blood inside the aortic space before the pulmonary or the right side. So here you can see that. So here you can see that some differences between the right and left side. The same mechanism will occur. The 7 phases of cardiac cycle will occur in the right and the left side. However, we have just a little different differences, so you can go through it and we discuss it and try to use your brain. 1 + 1 = and this is mechanics. Mechanics مبنية على الأرقام، مبنية على الحسابات. مين قبل مين عمل إيه، مين سوى إيه، واحد زي الواحد سوى. It's very easy to understand the 7 phases just if you understand the steps and the mechanism by which the blood is moving. And just try to remember that even there is an interaction or just overlapping between the different phases, because that a single cardiac beat just it takes very, very, very short time. But this is why it must be rapid and just overlapping and just to keep things moving and the blood pump inside the body. So now we have finished the cardiac cycle. المفروض I just understood that Dr. Rafat is going to finish the cardiac output with you maybe tomorrow or something like this, or maybe has already finished it. So next time I'm going to talk about the cardiac reserve. We have a core system. We have a certain amount of blood inside our body, representing 8% of our body weight. So if we have someone around 70 or 80 kilograms, so we have 5 liters inside the body, and we have a single pump with a certain size. So how can we push more blood and make the cardiac output moving from 5 liters up to 25 liters per minute? So So how the heart can perform and increase itself and just give you more capacity without changing the actual volume and the actual capacity of the pump itself.
Increasing speed of pumping.
Increasing speed
Pumping.
of pumping. So what will happen with the increasing of heart rate, the pumping?
It will give us more blood.
Moving the blood faster, so the blood is returning once more, so I can push, instead of pushing 5 liters per minute, I'm pushing maybe 10 liters per
So
minute.
instead of making it 0.8, it should be like less, 0.4 or so.
So this is one mechanism. Do you know any other mechanism?
Hormonal?
Muscular? Say again? Someone said muscular.
Hormonal? Hormonal.
So this type of regulation, not mechanism of pushing. So I'm regulating something, something inside the heart by hormone or autonomic nervous system, the autonomic nervous system. But what is the main mechanism that I'm controlling, that I'm regulating? So we have one, a heart rate. What else?
Does it increase in volume? Does the heart chamber increase in volume?
The volume of heart.
The heart chamber. Does
The heart shape.
increase, in volume, or it's fixed? Like during running, does it increase in volume? The heart chamber itself.
Well, okay, so, but there is a more important mechanism. So how do you increase the strong volume? Exactly. The heart does only two functions: running and contracting. So if you increase the force of contraction, so you are pushing more blood, the strong volume is increasing. And if you are increasing the running or the rate of the heart, so it's moving the blood faster, so again the blood, the 5 liter will take less time to go back again to the heart, so it will push it once more, so I can push the same 5 liters instead of in 1 minute, I can use 30 seconds or even maybe less, up to 20 seconds. Okay, so just two main mechanisms, the rate and the force of contraction. This can be regulated by hormone or neuronal by the sympathetic nervous system. So next time, inshallah, we're going to talk about this in details. Just I'll give you some time to get ready for your anatomy exam. Hopefully next time I'll find some interactions. And when is your first quiz?
March 2nd.
So it's next week? يوم السبت؟
إن شاء الله.
أنا هكون معاكم، أنا مش هحكي هاكل. أهلا وسهلا بيك. مش ضروري طيب عشان تتعامل معاكم في الأول. ناخد ندي مع بعض، مش أنا اللي يسمعني كنت تسمعوا. ها؟ أنا أكتب توتوريال.
For the next upcoming quiz, the questions of your lecture, حضرتك هتحطها ولا دكتور محمد؟
My lectures, I'm responsible.
Because
Dr. Ref's lectures, he's responsible.
I'm surprised حضرتك مالك عارف موضوع المحاضرة.
لا هو ما فيش محاضرة خالص، هو الكويز كلها مدتها.
لا في محاضرة في الساعة الثانية الكويز نص ساعة.
طيب هيبقى ساعة ونص المفروض المحاضرة. I didn't, because just what is written there, it is from the March the 2nd till the 7th of March. So I'm not sure, maybe you will have it for Sunday. فاهم قصدي؟ أنا ما أعرفش. لا ده أنا حسبت تعطيكم من السبت إن شاء الله. طبعا أنا عملت النهارده وفوت هذه الفرصة. أي نعم.